Dr. Thomas McGovern, co-host of the Dr. podcast and radio show heard on EWTN Radio, joins me now on Skype. Dr. McGovern, welcome. Thanks so much for joining us. As we just heard, presumptive President-elect Joe Biden says that he'll ask Americans to commit 100 days of wearing masks as one of his first acts as president. What's your reaction to that? And also, how helpful do you think that will be in reducing the spread of COVID-19?
Well, masks definitely make a difference. They've been shown in studies to reduce transmission where large groups are wearing them, maybe by 2/3, even the regular surgical mask. I think it's going to be a hard sell. I'm going to be wearing a mask for the next 100+ days, probably in many situations. But when it comes from a national level, we find that people are unlikely to do it unless somebody in their close circle has been or is being affected by it. I think without local control over it, I think it's going to be hard to get people to abide by.
One of the things we're also following, as I know you are as well, is the developments on the vaccine front. What are the guidelines that Catholics should follow about vaccines?
Well, I think there might be a moral duty to receive certain vaccines to help protect other people. But as far as what we need to know about the ethics of how a vaccine was produced, we have vaccines in 3 categories here. We have those like the Sanofi Pasteur vaccine, which involved no morally illicit methods of production. We have those like the Oxford AstraZeneca vaccine, which are produced in cells derived from an aborted baby. And then we have this new in-between group where some of the early testing to see if this idea of the mRNA vaccine was going to work were done in cells from aborted babies. But the production of the vaccine uses no cells at all. That would be the Pfizer and the Moderna vaccines, the ones that are closest to coming out. Our bishops have said that those vaccines are moral to receive, while some individual bishops and other groups are saying, hold on, they're not completely morally clean. And we need to, if we receive those, we are allowed to in certain circumstances, we must protest in certain ways that we want them in the future produced completely morally clean.
There's another thing I want to get your input on, and that's the debate that's been going on about whether or not we should open schools up for in-person learning. What do we know about the safety of that? And also, what are the implications of not opening up our schools?
The mental health for students, especially younger students, is dropping when they have to stay home. Anxiety is going through the roof among these groups. I hear it from colleagues of mine around the country. We know that it can be done pretty darn safely with distance and mask wearing. And Benedictine College, great example this week. They completed their first semester. All classes could be done in person, except if there was a professor who was older. And when they were done, there was no contact tracing that revealed classes causing spread. There was no spread in sports events. It was virtually all in living situations. So we know that classes and even sports can be done safely, even in a pandemic.
We don't have a lot of time left, but I really want to get to this last question as it's important to all of us as Catholics. That's being able to attend Mass, especially during this time of year. What are some of the measures that you would recommend to reduce the risk of transmission?
I'm a broken record. Wear your mask. Wash your hands, stay 6 feet apart from non-household groups. It works. There's no evidence of things being spread, causing outbreaks when this is done. The outbreaks occur, no masks, close together, singing, not washing.
All right. Any final thoughts or advice that you can give to our viewers right now?
There is good news. There's light at the end of the tunnel. Helpful vaccines are coming. Mortality rate is dropping, but the hospitals are nearly full, so we need to keep doing our best for others so that we don't overwhelm the hospitals.
All right, Doctor, thank you so much for your insight. We really appreciate your time today. Dr. Thomas McGovern, co-host of the Dr. podcast and radio show heard on EWTN Radio. Thank you again.
You're welcome.